Easier said than done, Mr. Trump. Of course, I don't need to tell you. Anyway, that's the worst they can find. It's true what Donald Trump has said. The worst he has is need to lose a little bit of weight. Then if his cholesterol is as low as we hear, blood pressure is as stable as it appears to be, maybe much ado about nothing. But again, that is something that we gleaned from watching Dr. Oz. What we did hear from Donald Trump today is that it confirmed again that he, even though he has a penchant for fast food, and I don't know who could have a penchant for fast food, but he's not big on alcohol, doesn't like tobacco, never had it, and caffeine is a no-no with him, but everything else is fine. Now, Dr. Tiffany Sizemore is joining us right now. She's heard that. She's had a chance to take a peek at Hillary Clinton and speaking in North Carolina. By the way, Hillary Clinton is going to be speaking to reporters, we're told, very soon. We'll go to that when she does. Maybe she'll answer some of these questions. But, Doctor, what do you make of that? I mean, we race back and forth, and you look and examine, I'm sure, both of these candidates. On Trump first, and the fact that he likes fast food, but apparently he doesn't drink, never smoke. Does that offset a lot of the things doctors like you worry about?
You know, I don't really think it offsets it. I tell my patients a Big Mac equals a big belly. You know, I definitely
well, I guess it depends on how often you have the Big Mac, right?
Of course, of course. So, you know, abstaining from alcohol is huge.
Right.
Obviously, not smoking is a biggie. Everything in moderation is really my key with my patients. You know, if someone has to have their Big Mac once a month, I'm not going to tell them no. They're not going to die from having a Big Mac once a month. But again,
what
if he's
about,
having McDonald's at every meal, you know, it's potentially a problem just because we know it's not good for you. But at the same time, you know, I looked at Trump's numbers, and his cholesterol is impeccable. Now, he is on cholesterol medication, which is a reason his cholesterol numbers are probably so wonderful. But, you know, I would say at least he's being humble in the fact that he knows he needs to lose some weight, and I think that that should really be his goal at this point.
Doctor, now switching to Hillary Clinton, a lot of people were scrutinizing how she looked today. I thought she looked fine. I'm no doctor. But the argument was she wanted to get on the stump right away. She was diagnosed with this pneumonia condition last Friday, I believe. What do you normally tell patients if you diagnose them with pneumonia? How long would you tell them to rest or in this case, not get on the campaign trail?
Well, you know, if I had a patient that was her age, that I believe she's 68 years old, you know, has, you know, not that from what I can tell, too many other medical problems, the history of the blood clots and the hypothyroidism from the medical history that was given from her doctor, you know, most of these patients are actually hospitalized, given IV antibiotics and IV fluid hydration. My patients would be a minimum of 1 week. Obviously, she's in a different scenario. I'm not sure if that's even manageable for her to take a week off. But, you know, realistically, it should be a good, solid week of rest.
All right. We'll see. And we might get an idea more when we see her go before reporters. Yet again, Doctor, thanks for taking the time. I appreciate that.
Thank you.
And thank you for the Big Mac reminder. You don't want to cut them out. Just don't, you know, just saying. All right. We got a lot more coming up here. This is